use ultrasound to identify, I injured my hand and several weeks ago, and I've been developing a slow inflammation and painful popping. So the good news is my volar plate's intact, so I'm looking at my joint where it's flexing. We use ultrasound as a big tool for us to help diagnose and confirm diagnosis, looking at ganglions, ligament tears, tendon injuries. It's a really effective tool, and it's minimally invasive and gives us a lot of information. So you guys can see actually my middle finger moving back and forth here, okay? And then, can you freeze that right there? And then this is my joint, so that's, my proximal phalanx. There's my metacarpal head. There's the volar plate. There's the tendons, and then we're looking at my pulley system. Now we're looking at I always tell people this is like looking at a bag of toast. I'm saying, like a loaf of bread. And then if we just go perpendicular, this is called a cross section. This is like looking at a slice of toast. So now you can see the issue here. So the good news is I don't have a trigger finger, but I do have some pain and discomfort in my intrinsics. And there's like a popping sensation that I have. So I think I have a small tear in my tendon, which I suspect is right about here. There's like a little bit of a reflection there. See, that looks normal as I move it here. But then when I come up right here, this is where it's really painful. My hand's really painful. And there's just a little bit of swelling. So if I freeze it, if you guys can see it right there, there's my one, there's actually two tendons here. We're gonna expand it here, that's kind of cool, okay? So we have the flexor digitorum profundus and superficialis tendons, and there's a little bit of a shear tear in my flexor digitorum superficialis tendon, I think as a result of the injury that I had. And again, if I go in this longitudinal view, I'm looking at one tendon, so I'm going to try to move just one tendon. So there's a lower tendon. If you guys can look, the lower part is moving more. That's the flexor digitorum profundus. And then if I flex here, both tendons, you can actually see that's the superficialis and profundus. Basically, it's a really amazing mechanism. Just think of like how cranes operate and things like that, the way our tendons are designed to help us move. And again, right there, that's where it's so painful. I think, right where I think I have a split or a tear right there, and my tendon on top, right kind of where it kind of seems to go side to side. When I'm trying to make a fist, it really hurts. When I'm trying to grab things, it really hurts. So the nice thing is what I'm doing here is also I'm just trying to make sure, like over here, if you pay close attention, you see a little pulse. There's actually the arteries right there. Can you put color? Put color flow. Let's see if we got. And then, yep. Let's up slowly here. So you'll see it picks up like a little bit of right there in the middle. Every now and then you're seeing it pulsating, and let's go to fast flow. Just go to, nope. That's gonna color flow. Yep. There we go. And sometimes if we close the square, there we go. You guys can see the flow now. See? That's the artery right there. See that? And then my nerve is right by it. So that way we're making sure that we position everything. There's also a nerve and artery on the other side. Guys see that right there? That's kind of cool. Okay, so I'm going to inject right where it's kind of irritated. Okay, and then okay, and this does hurt, so it's not like I'm being like super manly or anything like that. Okay, 1, 2, 3, poke. You got to go in, and then you inject. I'm right in the tendon. A lot of pressure. This is actually me injecting myself. Nice and slow. And like I said, guys, it does hurt. I'm not trying to, you know, this isn't like, oh, look at that, you know. I still get the chills, I still get the shivers, things like that, but no one wants to inject the boss. And after we inject, you can see the tendon right here, and we're just making sure that all the material's in there. Yep, and let's get rid of the color. There we go. And so now my finger's going numb. So then it feels like a toe. And right about here is where I injected. And you'll see like little crystalline deposits, like little, you know, it's not. There we go. Can you freeze it, you know, real quick? So you'll see some of the material above and below where I injected. And now, believe it or not, my hand feels a lot better. Okay, my middle finger feels all numb, but that pain in my hand is gone. So that's how we inject a trigger finger.